I don't see Ripley yet. We have Vitale in here. All right, I think we're still waiting on Trish. Trish, going to be coming in, and she was just on our last meeting, so I know that we're waiting for her. There she is. Okay, wonderful. All right, Tim, Peters, Pinkney, Ripley, Vitale. So we have just Ripley.
I'll text him, Mr. Chairman.
What's that?
I'll text Ripley, just see if we can't grab him.
Yeah.
Good evening, folks.
Oh, hello.
Hello.
Chairman Foley, you want me to put my hand up now or later?
What's that?
You want me to put my hand sign up now or later?
Just give, I see it, Timmy. Yes, I see it. Thank. Oh.
Check, make sure that it works.
I see it loud and clear.
Alternate key, tab.
I would
Just
motion.
to people to put yourself on mute if you're not speaking.
Yeah, I used to be able to do that. Oddly enough. Let's see here. Stop. Oh, I can mute everyone. All right, I'll do that. All right, everybody's muted now. So if you want to talk, make sure your your mic is on. So, hey, Rich, do we have department heads in chambers or no? Your microphone's muted.
I thought that some are in chambers. Yes, that was my understanding. I think Chris is in chambers.
Oh, hey, Chris Palermo, can you hear?
Okay.
I'm here.
Do we have department heads in chambers right now?
You've got nobody in chambers.
Okay, good. It's going to be a short meeting then, that's for sure.
Department heads were given the dial-in numbers, so there might be some on there that I'm not sure who they are, like the CC person. I'm not sure who that is.
Oh. Mary Beth Leeson, I'm here just listening in case there were questions about munis. That's it. So I'm only here for a short term.
Okay, I mean we're actually only missing Sue Dwyer. So, and Kate and Cheryl already sent in their report. So actually we can just get the meeting started. So I'll take a motion to approve minutes.
Move it, Didio.
Moved by Didio.
Second, Pinkney.
Wait, oh, wait, Didio's not on the committee. I'm sorry. So I'll take the motion by
This committee.
I'll move it.
moved by Trish, seconded by Pinkney. Any discussion? All in favor?
Aye.
Aye.
All opposed? Carried. Okay, great. So, Cheryl and Kate, did send in, an update. I forwarded that on to all you folks. I don't know if anyone had any questions about that, but they do have the two resolutions, GO2 and GO3, that were just grants, that their office accepts, to be able to function. And, I mean, it has nothing to do with, any money, monetary value coming out of our pocket, certainly. So if we want to move those along, GO2 and 3, I'll take a motion for them.
I'll bundle them and move it. Vitale.
Second by Petrus.
Okay. Any discussion on those?
Mr. Foley, could you pull the screen up so we can see the motions? Move the screen up.
Well, yes, it's up there. It's just not on them, but
Just click on it.
There you go.
Now it's there. Just moved up.
yeah, we moved to GO2 and GO3, Timmy, if you want a second to read them.
Okay.
All right. All in favor, say aye.
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 All opposed? Carried. Okay, great. If anyone has any questions for Cheryl or Kate, let me know. I know that they did say that they're having absentee work being done for everyone to be able to vote via absentee ballot, and their office is kind of swamped right now, and so it's a work in progress. But they're on it. I'm welcoming that they're on board. Timmy, question.
Are we all done with the motions tonight? Can we have a discussion or no? Not on this subject, but on another subject?
Well, let's go through the committee, department head reports, and then we'll have a discussion at the end. Does that work for you?
Perfect.
All
Thank
right.
you, Mr. Chairman.
Yeah. Amanda Morgan, you are up for the clerk office.
Nothing new to report. I've pretty much been working from home, and Sheila's been working in the office. Some days working at home, but we're both still completely available. If you need us, just always call us. All right. Hope everyone's well.
Wonderful. Now, if we call the office and Sheila's not there, does it forward to you, or how does that work?
My phone number, if you call me, it comes right into my Surface, and Sheila's as well. So no matter what, if we have it at home or the office, you will reach us. And I have all of the stuff on my computer to be able to email it to you immediately.
Oh, that's great. Okay. All right. That's efficiency. Certainly. Any questions for Amanda or the clerk's office in general? All right. Moving right along. Thank you, Amanda. Next up is Chris Palermo, County Attorney.
Thank you, Mr. Chairman. Aside from dealing with the COVID-19 matters in the health department and the chair, we've been just tackling work as it comes in, highway contracts. Rich has been working on some contracts with nursing staff and various other things. Brittany's been doing a bunch of research, and we're just trucking along dealing with county business. That's about it.
Okay. So, Chris, has everyone in your office, are they in their spots now and up to full function? I know that a couple of months ago, 2 months ago, we passed the spot for Brittany, and Lacey was going to move. I just want to make sure that that's fully functional now and everything's going well with that.
everybody is fully functional.
All right, I like it. Any questions for Chris Palermo? All right, hearing none, we'll move on. Yeah,
I have a question. Chris? Chris?
Yes.
Last night at the meeting, I asked Tracy from CETA to give us a financial report, and Chairman Batman indicated that I might have been out of order, but I've asked the chairwoman to give us by agency all the different finances so that we can make better decisions if we know how our financial standing is and what our obligations are going forward, such as our health insurance bill, our pension bill. I'd like to double the highway this year because of the cost of asphalt being low, but I think we need to know how long we could sustain ourselves if we didn't have any additional income coming in. Is that a proper question to ask? And as a legislator, I think I'm entitled to the information, but I don't want to be able to, step on anybody's shoes. But I think the governor has allowed us to look at the Industrial Development Authority and CCDC, any monies that we have with our sister organizations that we're able under this crisis to use. Is that not correct?
Well, so to answer your questions, I guess preliminarily, I think it's an appropriate question for you to ask about the finances of agencies. I don't see any harm in that. The second question was, how are these things going to impact our finances? And I think the place to look there would be the budget. And, we have projections in there for sales tax, certainly. We have various other revenue projections that we made at the end of last year to determine what our tax levy was going to be. And at the present time, I don't know that, my crystal ball or the treasurer's or yours or anybody's better than anybody else's. So, sales tax is really going to be the primary driver, I think, of county finances going forward. We haven't seen any real solid numbers on that front yet. Certainly can tell you what the fund balance is. I could get that from Ms. Marinelli. But the sales tax is going to be the big thing, Tim. With respect to the IDA and the CAPUSA, various other sister entities, as you called them, I did send you an email today because I'm curious about this. I was looking actually through the governor's executive orders. I was unable to find any direction on this particular issue. So I'd like to talk to you a little bit offline. After the meeting, maybe we could chat about this just a little bit and see if I can get a little bit more direction.
Well, I mean, when you ask a direct question as to what our finances are, I would hope we'd get a straight answer back saying that CCDC has $1 million in the fund balance in their budget, or let's say our consortium, we used to have 10 million. We reduced it down to 6 million because of helping out our employees with their share. I mean, I would think in order to make good decisions going forward, we'd have to know what our financial situation is and how long we could hold out if we got no sales tax.
So you want to know what each of those agencies has in fund balance? Is that accurate?
I mean, I asked CETA last night. I think under our agreement, anything that they don't use is supposed to be returned back to our general fund, just like any other department that we have. And I don't think that's been done.
That's contractual. I believe that is in the contract that we have with CETA. That's correct. I don't know that we have that provision in any other, like the CCDC or the IDA. Those are independent authorities. We don't have a contractual relationship with them. So I'd have to dig into that a little bit more. But those were some of the issues I wanted to talk to you about, I guess.
Yeah,
I think we, as legislators, we should know exactly how much reserves we have and where they are in case under the pandemic, whether or not we have to use them.
Tim, I think it would be good to sit down with Chris and get him your exact questions on any contracts that you have or otherwise, and then go about getting them answered like that, and to see what exactly you ask and what you can't, and then go about doing so.
Thank you for that direction, Mr. Chairman, and I appreciate talking to Chris at any time, being a fellow legislator. Time he understands the sixth floor. I just don't want to I want to make sure that the general public knows where their tax money is, what departments, and what's available under this crisis.
Appreciate that effort, Timmy. I certainly do. I have Tricia Kerr that wanted to speak.
Yeah, thanks, Ryan. I just kind of wanted to echo Tim's sentiments. I totally agree. I think that we generally all agree that we need to get our arms around the financial picture of the county. Things are going to look very different. Our chairwoman sent an email earlier today, not too long ago, so you may not have seen it yet, but she has asked her budget director and deputy treasurer to start compiling a financial picture for the legislature to begin looking at this stuff. So I think that is happening, and I look forward to that information as well, Tim, because I think it is important, and department by department as well, because different departments are going to be impacted differently. But we do need an overall financial picture, and it sounds like that is in the works, and that staff have been directed to put that together for the legislature.
Right. Whether or not the 4 million buildings, whether or not that's available to us going forward. And I mean, we spent $1.5 million last week on a lawsuit, which I'm a little upset with, but what do I know?
Okay. All right. We're moving forward. Any other questions for Chris Palermo? Okay, hearing none. Thank you, Chris, for your update. And we'll move on to Paul Borman.
Joining in. Thank you. How are you?
Good, Chris. How are you? Or Paul?
That's right.
Yeah.
So my report, I've got the one resolution, and I have the committee report, which was put together about 2 weeks ago. In the committee report, do you have any questions specifically about anything on that? Otherwise, I'll jump in and highlight a couple things.
Well, how about you highlight a few things, and then if we have any questions after that, we'll go. We can.
That sounds good too.
Perfect.
So IT has certainly spent a lot of effort recently working with to help the county work from home. This document is about 2 weeks old now, and so we're deployed close to 100 Surface laptops and notebooks. We've deployed close to over 50 iPhones out to folks, and I've been training well over 100 staff members on their use of new tools and new technology, including the 8x8 phone system and video conferencing, as well as other things to support work from home. We've connected the nursing home so that it can be functional for the health department. The health department has since moved on to other spaces. Mental health, we've helped them implement telepsychiatry so that they can continue to receive revenue while not seeing patients in person, so they can do it remotely over the phone and video conference. We've worked with New York State court system to implement Skype for Business and help implement other systems to support that group of folks. We've implemented telemedicine iPads in the jail so that folks in the jail can receive support from doctors when necessary without anybody getting infected. 911 implemented a dual center, and we set up video conferencing between the two centers so people could seem to be all in one space to help them with constant contact between the two buildings. And we've also upgraded our core Exchange servers, which provide email and calendaring for the county. And we've upgraded them to a current version of the product because they were needed. That upgrade was needed, and it was funded in our budget. So there was no real additional cost. It was just labor and focus. Let's see. We also talked about the COVID system. So that is actually the COVID response has delayed our implementation of 8x8 fully to the county. We had hoped to be fully implemented in the county today, and in some ways we are fully implemented, and in other ways we're not. So what specifically is left to do is to change all the physical phones in the county, and obviously we're cautious about doing that because we want to make sure the phones are disinfected first before we do touch anybody's existing phones. And secondly, with the offices closed, we don't have staff there to train them on how to use the phones. So we'll deploy the physical phones. We'll start deploying the physical phones over the next few weeks, especially as we start thinking about people coming back to work at some point. Last month, we had a resolution that went through to upgrade the PSB fiber connection so that it can support 300 meg of internet bandwidth, and that supports the public safety building and is also a backup service for the county office building and all the other major buildings in the environment. The resolution tonight, we are asking for a support for the county office building upgrade. This was planned and in our budget to upgrade from a kind of consumer grade fiber connection to a commercial fiber connection. Let's see, other things. The other big thing we've been talking about is a Munis upgrade. Mary Beth Leeson and I put some time together to summarize options for doing a Munis upgrade. The upgrade is required to support 1099 reporting in January. So we will not be able to do 1099 reports in January unless we can upgrade our Munis system. There's no cost for us to do the Munis upgrade. So we looked at, Mary Beth did a terrific job putting together a training plan and implementation plan for her staff to help departments utilize the new features in the upgrade. IT is going to build new servers to support the upgrade, and then the Munis contract that we currently are under will cover the cost to implement the upgrade by the Tyler staff, and IT will support that process. We do have a number of changes we have to make to the computers that are out in the field, but we've been starting to make those changes now as part of our overall support for the county. During the process for the Munis upgrade, we did look at two options, one being a feature upgrade, which would add document management and workflow for financial documents. And that's a $65,000 to $67,000 purchase to buy that license, and then about $7,000 a year afterwards to maintain it. We think that's a valuable feature, but we decided to hold off this year because of all the other work being done. We wanted to make sure we had time to implement it correctly and also make sure that we were in a good financial position to implement it. So we decided to be prudent and not implement that feature set. The other choice we looked at was, instead of hosting Munis at the county, we would move it out to the cloud, which is a more common way of doing it today. And that would increase our cost by over $100,000 a year. We decided that the cost doesn't offset the IT cost of running Munis in-house. So the value wasn't really tremendously, there wasn't a good return on that investment. So we decided not to move forward with that recommendation. So ultimately, the Munis upgrade will not cost us anything other than a little bit of IT time and quite a bit of the treasurer's office's time to train people on how to use it and then roll that out to the departments. But we expect the project to last from June to September. We're hoping to get it started after the busy time of the year now and before the budget season later in the year. That's going to depend, the schedule is going to depend on when we pull the trigger with Munis. So that was sort of the short one.
Yeah, no, that was great. I think that it's important to talk about the amount of work that you and Mary Beth Leeson did on trying to come up with a solution for Munis, because I think when we first started out the year, it was like, uh, oh no, this is going to become obsolete, and we have to figure out something to do with it. And it's been a kind of a work in progress, and we've been meeting once a month to go over some of this stuff. And so, and two, Mary Beth has been really gracious in all of this with her time, because there's an expected training period that she has to be able to train all the staff on a new system upgrade to Munis, and she laid out a kind of a detailed estimate on what it's going to take her to do that, and so she's really acting in a kind of a role here inside of doing her work at the treasurer's office. It's really incredible, and I want to thank her as well. So, I think it's moving forward, which is huge, from where we started. That's for sure.
Thank you, Mr. Foley. That was nice. I appreciate
No
it.
problem. Yeah. Do you have anything you want to add here? We just had a meeting before this where we kind of went into things a little bit more in depth. But if you want to add anything over besides what Paul said, that would be good too.
I think we're being conservative with what we're doing. We know that this is going to be, I think the important thing for everybody to know is that this is probably going to hold us for 2 years, and then we're going to have to upgrade again. So I think that would be the other important piece to know, is that we have to stay current on this. And I think the other piece is that the treasurer's office in the last year, I'm going to say, has been interacting more with Munis, and we've been doing training. And we're finding that we've been underutilizing it. And so now we're becoming much more maybe efficient and having a lot better detail in the software, which actually positioned us well as we went to working remotely, because now we're storing a lot of the data inside of Munis and can access it remotely.
Right. Exactly. Okay. So before we move on to GO1, does anyone have questions for Paul?
Yes, I've got one.
Timmy, go for it.
Paul, with the recent pandemic, pricing is not going to come down in a month or two. I mean, should we hold off on our purchases, or? And secondarily, Munis had 3 or 4 different things that they never did do. Did we ever get a credit back from Munis to on what they didn't do? They said it was going to do everything, and then it did half of what it was supposed to do.
I don't have the history on Munis as far as what they claimed it was going to do and what it didn't do. I wasn't aware that there were any gaps. I don't know if Mary Beth has any insight into that, but I don't have any insight into that. And as far as I know, it's fully implemented and it does what we expected it to do. But
Paul, I do know initially we were going to do fixed assets and payroll inside of Munis, and initially purchase those modules. And to my understanding, that money has been credited back because we didn't ever implement that.
Okay. Yeah. See.
Thank you.
And just Paul, would you explain again on the PBS or PSB in regards to the bandwidth? Denise was talking the other night and said that her 911 is all hardwired and she doesn't use any bandwidth. Is that?
Well, it's partially true. They have a lot of people using Spillman, which is the 911 system, remotely and getting into it. All of the counties, or all of the towns and villages and police departments have to be able to get into the Spillman system remotely to support 911 calls. So they all do use bandwidth to get into that. But I think Denise is referring to phone usage. Her phones are all hardwired on a separate network than our phones. So they are dedicated to 911 calling only. But all of their internet access and all of their other things are the same as ours.
And
Okay.
our secondary location at the county office building, is that how is that wired?
That's
By
all.
phone?
It's identical to the PSB. It is hardwired for phone service at the county office building as well. So they have a different phone system completely than us.
Okay, so they can operate one system is down.
Correct. That's the idea. Or they can do it like they're doing it today, and they're operating half in each.
Okay, thank you.
Yep, sure.
Okay. So would anyone like to move GO1 for Paul?
I'll move it.
Moved by Trish. All right.
I'll second it, Petrus.
Seconded by Petrus. Again, this is to enter in to an agreement to put fiber into the county office building so they have increased bandwidth. Any other discussion on this?
I guess I just would want to confirm one more time that this was budgeted for and it was in our plan and we're just implementing our plan.
Correct. That's
Please.
100% true. Yes.
Thank you.
All right. All in favor of GO1?
Aye.
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 All right. It carried. All right, Paul, thank you so much. And thank you for all of your work that you're doing. I know it's a kind of a crazy time for IT these days. So it does not go unnoticed. That's for sure.
I appreciate it. I wish there was a place we could go on vacation. Thank you.
Yeah. All right. Next up would be Sue Dwyer. I don't know if she's in here or not. Okay. Or Jessica Strassel from the Veterans. I know she's still working in her military position to help with COVID efforts. So I didn't expect her to be here. But if anyone has any questions for Sue or Jessica, just pass them along to myself, and we'll get them taken care of. I know that two members of the committee did say they want to speak before we wrap up. So I have Chris Petrus is first, and then Tim Lattimore.
Thank you, Mr. Chairman. I won't take up too much time because I know we got to get into Health and Human Services, but I just think it was poignant. I wanted to echo Mr. Lattimore's concerns about our financial picture. I know as chairman of Ways and Means, I will be paying particular interest to this because also what the county attorney said, Mr. Palermo, I do believe that the budget is going to have a shortfall, hopefully not to an extreme extent, but there will be some with relation to sales tax. We will have some impact on our budget. And I look forward to getting those numbers from the chairman, the budget director, and the treasurer's office, and really just diving down into the data, seeing where we are and where we need to be, and implementing that in the budget as we move forward, or the formulation of the 2021 budget. Thank you, Mr. Chairman.
Yeah. I echo that very strongly. That we all are kind of, I think, waiting for financial numbers. They're still coming and changing every day, and we're all holding our breath too. That somewhere the backslide drops. I think it's a work in progress that they're being collected, and I'm sure we'll get them as they become available. I know Trish said that Aileen had sent out an email pertaining to that. I don't know if I had a chance to read that or not. Trish, do you have that by chance?
I do.
Or any more details? Okay, great.
Yep. They're pulling together. Hold on one second. they are pulling together information to compile a financial picture for the legislature. The first quarter report, is not going to reflect the full picture. So as you guys said, this is kind of an evolving situation, but it sounds like the focus is on pulling together what information is available right now so that we can start to dive into the numbers and look at the data. So
Did
more to
she
come.
say when that would be? Or
Let's see.
Oh, sorry, Trish.
Sure.
It's Mary Beth. I was just going to say, Lynn and I did speak with the chairwoman today about doing a financial report. We've set up meetings every Tuesday and Thursday for at least for next week to talk, Lynn and I, to talk about getting our numbers finalized. I've been working pretty diligently as much as I can on year-end numbers. So I'm getting pretty close to figuring out what the final 2019 fund balance will be. And from there, we're going to build the first quarter. We're pretty current as far as reconciling the first quarter's, statements and that kind of thing. So I should be able to pull together what we've got so far. I don't think that you're going to see a huge impact in the first quarter because we were still collecting sales tax and we're on target for the first quarter. And we've actually gotten the first payment in April already for sales tax, which was pretty comparable to what we got last April. But we'll be pulling together some numbers in the next week for you to look at.
oh, that's wonderful. Okay, Tim, I see you have your hand up.
Yeah, I mean, the one cost that I'm concerned about is what the pension bill is going to be. Have we received our 2020 pension bill yet?
We paid the 2020 pension bill in December because we get a discount if we pay early. So that's already paid, and so we won't pay again until next December.
That's great. That's great.
Oh, okay.
Sorry, I didn't mean
All right.
there, but I just figured I could add a little light.
No, that was definitely helpful, and I know that Aileen and everyone is working on it, and so it's nice to have that update from you, and just to give us a little vision on where things stand, kind of day by day because it changes so much. So it was definitely helpful. Thank you, Mary Beth.
No problem.
And then Chris, Petrus, anything else before we move on to Timmy?
Thanks, I appreciate it. I just wanted to say thank you for the update. Thank you for the data that you have. I know you guys are working hard on it, and I look forward to seeing what you guys are able to come up with and produce, because the work is yet to come. And I just wanted to say thank you to everyone that's compiling that data.
Thank you.
Yeah. All right, cool. Tim, you're next up. What was your question? Or your topic that you wanted to discuss at the end of the meeting?
Oh, Mr. Chairman, I know we just went through this emergency situation. I was just wondering whether or not the committee system works better, or whether or not we should go to maybe meeting 3 times a month, have everybody there and vote it up or down on the different issues so we can move government faster than how it is done now.
Okay, that's noted. All right. So anyone, anything else to come before the committee, or I'll take a vote to adjourn. Motion by Ben, seconded by Paul, Pinkney. Any discussion? All in favor of adjourning?
Aye.
All right, meeting is adjourned.
Thanks, everybody. Have a good night.
Thank you.
HHS is next up, just so everyone knows. I think HHS is next if you're on that committee.
We just stay in this meeting, Ryan?
Yeah. Yep, you stay right in here, and then Elaine will take over from there.
The only one I don't think. What about the veteran?
What's that?
The veterans, we don't have to stay on this committee, right?
No.
Okay, thank you.
Ryan, was that a representative from the veterans?
Yeah, I believe that was Lindsay Wilkins.
Yes, Lindsay Wilkinson.
Oh, Lindsay, are you still on?
Good afternoon. How are you?
I'm okay. I'm sorry. I did not know you were on there, to be honest with you. So my apologies. Did you have something that you wanted to give us an update on before we kind of go into our next committee? I mean, not everyone's still here, but,
We're
you know.
running operations by appointment only, and filtering in as the director is, she's been activated to the Air National Guard, so we've just been by appointment only, honestly. And
Okay.
it's a little slow, but we've been able to work remotely, and each and every one of us have a device that we can take home and a printer and access that way. So we've been doing a lot remotely.
Okay. That's good to know. So people are still able to come to the office by appointment only? Is that right?
By appointment, yes. By appointment only. Yes, sir. And,
Chairman?
1 second.
just yesterday, I was in the office and had a gentleman come in because he was facing an appeal, which is in a timely fashion, and he was approaching the expiration date. So he did come in, but we practiced the social distancing, and he was okay with that, and we were okay with that, and yeah, but trying to run operation as is, but unfortunately, the hospitals are closed, or not closed, but for compensation, they're not opening back up until May of this year.
Okay. All right. That's
Mr.
good to
Chairman?
know. Yeah, Timmy.
The flags at the new Veterans Center on Genesee Street is at half mast. Is that for the COVID victims?
I believe so.
Okay.
I can't confirm that right now, but I will get back with you and confirm. But at this point, I believe so.
Should we lower the other flags or no?
That probably wouldn't be a bad idea, but until I have better confirmation, I can't confirm that at this time.
Thank you.
You're welcome.
Okay. All right. Thank you for that update, Lindsay. I appreciate it.
Problem.
All right. All right. HHS is starting, and Elaine will be starting here shortly. Thank you, guys.
Thank you so much. Have a good night.
You too.
The only one I think we're waiting on is Charlie Ripley. I don't think Hans is going to be participating tonight, but I don't really want to start without him. So, I mean, any suggestions? Chris?
I texted him. He didn't
Well-
respond. He was on government ops. And
Oh,
I hope-
okay. I tried him too. So, I mean, if he's not planning on, I tried his home and didn't get him either. So he was on government ops too?
Yes, ma'am, he was.
Okay, then, if we have a quorum, because Hans not going to be here, I guess we could start, should we? HHS committee members? What do you think, Rich?
Go ahead. It's up to you. You're the chair.
Oh, I love that power. Okay. What do you guys think? Should we just get it started?
This is Nightingale. I'm ready to start.
Okay. All right.
Ditto.
Go ahead, Trish.
Ditto.
All right. All right. Okay, we can start. I think Brenda's on, Ray's on, and Kathleen's here. So HHS has 6 resolutions tonight, 2 from the Health Department, 4 from the Department of Social Services. There are no appointments on the agenda, so if I could get a motion to approve the minutes, that would be good.
I'll make a motion.
Uh-huh.
Yeah. Nightingale seconds.
Thank you. All in favor?
Aye.
All right. Mike, you're still here, right? Yeah. I see you. All right. I don't know whether we want to start with the resolutions or start with the department reports or have questions for any of them. Do you have a preference what you guys want to do? You want to get through the resolutions and then we can go forward with the department reports or asking any questions of the department heads? Hello?
Good plan to do the resolutions.
Okay. All right. Right now we have HH1, which is to accept Healthy Neighborhood Extension Grant in an estimated amount of $141,000. Would go through April of 2020 through March of 2021. Can I get a motion for that?
I move. Nightingale.
Second. Okay. All in favor?
Aye.
Okay.
Aye.
If you could just say their names when they first and second, that would be great. Thank you.
Who made the original motion?
Nightingale first.
And then seconded by Kerr? Mike?
I'll second it. I wasn't sure if somebody seconded it or not. I would certainly second it.
Okay, great. Then second resolution, HH2, is to create and fill a billing specialist position, which is a grade 19 to supervise early intervention in 3 to 5. Would be a promotion of a current staff, a change from a principal account clerk, grade 14 to 19. Could I get a motion for that for discussion?
Elaine, can we vote on HH1, please?
Oh, I'm sorry. I think we are all in favor of HH1.
Aye.
Okay. Any opposed? All right, great. HH2, if I could get a motion and a second for that.
I'll motion for discussion. Nightingale.
Second. HH2 was the create and fill of the billing specialist position.
I'll second.
Okay. All right. Any discussion?
This is Nightingale. I feel at this time that we should be judicious and follow the example of other committees and our chairwoman, Aileen, and table this position for at least 60 days.
Okay. The motion is to table till the June meeting. All in favor?
Any discussion on that?
We can have a discussion on that. Instead
I'll
of
need a second on the table as well.
okay.
Madam Chair.
Yeah.
What kind of billing specialist? I know that at the hospital they had a system, or they had a problem with billing, and it cost the hospital about $8 million, and they had to bring Wellspring in to straighten it out, and it cost them to bring Wellspring in about $2 million of underbilled billing. Do we bill people for services, and if we don't have the right codes on it, I hate to see this go unfilled.
Well, Kathleen can speak more to it, but my understanding is this current employee had gotten out of the the billing of the early intervention in the 3 to 5, but she's found herself in a role of needing to support and supervise a current staff. So the hope was, when she introduced it, that potentially we would upgrade this current staff and compensate her for the supervision that she's currently doing. And she had made the argument at the last HHS meeting. And at this point, I think the more of the discussion is not whether or not the upgrade, which is not significant amount of money, is warranted. It's whether we want to be upgrading positions at this time, or do we want to wait until we have more information about where we are financially. So that was the reason, my understanding, to table it till June, certainly not defeat it, but to relook at this position again at our June meeting.
Well, I mean, I'm all in favor of what Heidi said, to go along with what our other departments are doing. But if this if this brings money back to the county and by underbilling, we're losing money.
Kathleen can do it. My understanding is she's currently assisting with this work right now. This would be upgrading the title to give compensation for that. Is that the case, Kathleen?
That's correct.
So the work is getting done, Tim. This is really about making a change in a title of a current employee.
Is there a question whether this employee is working out of title right now? Kathleen?
The employee has not brought that forward.
Okay.
Kathleen, through these billings, do we get money back from the state or feds?
We do, yes.
Well, that's an important position. I want to make sure we're billing correctly.
Heidi, you want to say something?
Yes, I just want to mention that the resolution does include, per the question about working out of grade, that in the third whereas, the Civil Service Commission recently reviewed and approved the duties and classifications of the full-time supervising billing specialist.
Okay, so I guess going around and round, what there's originally a motion on the made to table this resolution and amend it and table it till June. Do we have to vote on that at this point?
We need a second on it.
Okay, does anyone want to second that original motion?
I would second tabling for review by the committee that has been established to look at our workforce needs at this time for this particular position. I do agree it's an important position, and I think that we need to be billing and making sure that we have the staff to do the billing, and the billing is complicated and it is important, but I do not believe it's necessarily urgent, and would like to see it go through that process and be evaluated within the context of the global picture for the county workforce.
Okay. Can we get a vote on that? Who's in favor of the tabled resolution?
Aye.
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 Any opposed? Okay, thank you. All right. Do you want to do your update now, Kathleen?
Sure. So this is a better connection than I had last time. I like it. So kudos to IT helping us out there. So what have we been doing? We've been doing a lot, all primarily related to COVID-19 response. I'll just think about, there have been some different things forthcoming that will come up for discussion as far as whether they're considered mandatory or not. For instance, we're going to learn more about campgrounds and whether they're going to be opened in a, sooner or later right now. Our WIC office, I think I mentioned previously, really going strong. They're serving numerous clients and more clients, and doing so remotely. Really doing a great job there. Other employees have really picked up duties as part of our response planning. So, for instance, we have people in our early intervention area, the service coordinators, who are calling back our community members who have negative lab results. So that's always, good news to deliver. We also started utilizing some of our Auburn and Large City School District nurses. We're just rolling them in, and they're working some telephone work for us, which is, again, it helps to not only provide the service we're supposed to, but with our employees who are performing this duty, it allows them to spend more time working in some other areas. Again, primarily thinking of our nurses in that regard. We had our environmental health people, one of our environmental health people has just taken to being in charge of all our purchasing, and she's doing a great job. And you wouldn't think that necessarily there's such a huge need for that, but it's the purchasing and the inventory. So it's inventorying all of our personal protective equipment, anticipating needs, working with EMO, working with our purchasing agent for the county, but also working with the employees that Ray through social services helped to designate to assist us in providing for the needs of some of our people in isolation when they arise. So that's, again, going really well. We also have someone from our environmental unit who's assisting our nurses who are doing the testing. We also have environmental health staff who are doing some of our drive around the county to lay eyes on people who are in isolation and making sure they're home, and just doing a double check with those individuals. We got a really a great compliment from someone who had come out of isolation and was particularly complimentary of not only all the people she spoke with here when she called with questions, but was quite pleased and looked forward to the visits from our environmental health person who would come by and just kind of help her laugh a little bit every day. So that was, I thought that was great that she mentioned that to us. It kind of helped everybody feel good. No secret that our numbers are climbing up. As all of you, I'm sure, are aware, we got notification of the first person in our county who died as a result of COVID-19. And I think it's been rather, I think humbling was a good word that was used by someone else, because this was not the stereotype as far as classified as an older person, so someone in their 40s. And it brought home how potentially dangerous this virus is. Right? So as we're seeing our numbers climb, I guess we'll see what direction things are going. We mentioned yesterday that New York City is hopeful that maybe they're at their peak and might be starting a downward trend, but upstate New York always has that lag from New York City, and we are just climbing our hill right now. It appears also that people, again, who desire testing and it's considered appropriate due to symptoms, that's still the state recommendation, is that you are symptomatic. I believe that everyone is able to get a test who should at this point. So we've got our various options. We've got Onondaga County and Tompkins County through their drive-throughs, if people can register and, if appropriate, be tested there. If their healthcare provider make recommendations to us, our staff here at the health department are still providing service. And just open this week and will be, I think we'll have more conversation around it, but the respiratory care clinic that is being housed at the former county nursing home is opened its doors and is taking appointments now to receive anybody from around our area who has respiratory illness. We'll take a referral there. It's by appointment only. And if necessary, they can perform a COVID test, or they might be able to screen someone and send them over to our community-based testing. We've also partnered with our Port Byron Healthcare Center, and we've done some mobile testing, I'll call it like a fly team, going to some work sites to provide testing, essential work sites. So that seems to have been very successful as well. And still it's a 7-day-a-week operation, like we said, but the staff are great. The health department staff, I can't say enough great things about them. Everybody is taking the right attitude and is so, understands the importance of the work they're doing and does so. And I think it's really great customer service that people are getting. And I'm completely impressed every day.
Tim has a question, and then Heidi.
Kathleen, congratulations on putting together a good team. And I'm just wondering, in regards to the billing, are back charging to the feds any additional cost regarding this outbreak?
What I can tell you is that we are tracking our time very specifically. So not only on our timesheets, but we break it down onto more detailed sheets that say what type of work we're doing, whether it is testing work, whether it's isolation and quarantine, whether it's risk communication, and that our accounting staff, our fiscal staff are utilizing that to put against some of the grant funding that we have. And then that will also be held on to as part of any potential additional funding that comes our way, whether that's, through the state, through the feds. I'm really deferring a lot of that to our financial experts to analyze at this point.
Well, I mean, if we have to hire somebody to make sure that we account for all the costs related to this, that we can get, FEMA or somebody else to come back and reimburse us, we should be on top of that.
I do believe that not only within the health department, but throughout the county, people are being very conscientious about identifying their time that's being spent toward this public health effort.
Mm-hmm. Well, I'd like to just congratulate the warriors at the hospitals and all the healthcare people. In regards to healthcare, are some of our student nursing, are they in class? Or I think in New York City, didn't they call them out to assist, or no?
I'm not certain. I believe that the college nursing students had finished their rotation, so I don't know if they're working remotely. I think our college nursing department could probably speak to that better.
Mm-hmm.
Heidi, do you have something? Or Tim, Heidi?
No, I'm done. Well, I got one more, but go ahead. Heidi, go ahead.
Hi, Kathleen. I just wanted to applaud you on your efforts and want to send a message back to your staff of great thanks and gratitude. I can imagine the position you are all in. It truly is 24/7 for all of you. I do have a question about the transparency of reports, and we're getting reports, which is wonderful, very quickly and daily from you. What we see on those reports are whether or not a case is in the city or not in the city. And I'm wondering if there's the potential so that people don't stay complacent and think this is not my town, this is not my village, or this is not my city. If there's the potential for more transparency in the reports, or what your feelings have been about not mentioning that.
So I've heard some of those comments also. I guess first I have to say it is very short-sighted if someone thinks that this virus is not in their community. It is everywhere, and I can't stress that enough. I think there's a curiosity for people to know whether there's a case in Weedsport or Moravia, and I fully appreciate the curiosity factor. I think with the numbers that we have currently of our positive cases, I am very hesitant and am not looking to reveal zip codes or towns at this time in order to protect the anonymity of the people who have been diagnosed, because we have found in other circumstances that people are being kind of painted with a scarlet letter. However, I do realize that people identify more with their own backyard. I get that. I think as we see more cases diagnosed, perhaps that will lend itself more to be able to say that, but I really like to see what transpires. I guess I ask all of you, and I said it on other calls, complacency. This is not the time for complacency. It is throughout our county, north, central, south, right up top, right through the bottom. Not all of them are, there's some are in the city, they're around the city. It's just very short-sighted for people to think that this is not a real threat to their health and well-being just because they don't know if their neighbor has it.
Thank you.
Thank you.
Anybody else have questions for Kathleen?
Yeah, one more. Kathleen, there was an outbreak of flu, I think, in Cayuga, like in December. I mean, do we know whether or not maybe we had it here sooner than later? I mean, do we know how to test for antibodies or to see whether or not, like you say, from top to bottom?
I can't speak. So certainly there could have been cases here prior to them being tested, because until we had a means to test, it wasn't being done. Right. So it certainly is a possibility. What I have understood is that through Upstate Hospital, one of their infectious disease doctors is reaching out to some people who have been diagnosed and are now and are healthy again to do some serology testing. And I think that's being done in other places as well as part of a larger study to get a better sense of, what were your symptoms? When did you know? How did you fare? What can we learn for those of you who have recuperated from a known diagnosis?
Right. And also on the, I asked for no visitation from for the prison. Our prison population's pretty healthy.
To the best of our knowledge, that is the case. We have had some interactions, as all of you are aware, when there had been a prisoner who had been transferred out of Auburn Correctional Facility to another facility. And there were a number of corrections officers and support staff who were in quarantine as a result of that. So we do have some communications with their infectious disease nurses there in the facilities. And that's, they're very willing to help us. Again, to the best of our knowledge, I believe that there is none within the walls, but
Yeah, I mean, it's good cooperation between that population and in your office.
Overall, yes, I think it's been a challenge right from the start, though, Tim, because corrections has been such a historically, it's not just this, kind of its own entity. So the state health department is really trying to work more closely with State Department of Corrections to try and facilitate discussions. But I reached out a few times to some people in state corrections and had very ready response, and it was very helpful. And our staff here in our office locally were able to reach staff locally in Auburn facility, the nurse there, and as needed, a nurse at Cayuga facility as well.
Trish, did you want to say something?
Yeah, I thank you. First of all, you guys are doing a great job managing everything. I just wanted to ask you about the hotline that was set up, and are people using it? Are people still calling the health department? What should people be calling that hotline for? Just to get an idea of how it's being used right now. Kathleen, thank you.
So I think the county resource line, Kelly Anderson has been monitoring that and has seen some of the calls diminish. So they're looking at some considerations about shortening the hours potentially there. The calls that we've gotten, not as many to our 1157 extension. Most of them still tend to come through our main line, but we've been able to link those lines together. So it's been helpful to pick up the calls. We're not getting the same, it waxes and wanes with the number of calls we get. And I will say, many of you are aware, our phones were blowing up a couple days ago when people were saying, there's no social distancing happening on the golf courses. I'm like, well, we'll follow up as we can. So sometimes it's about health needs, and sometimes it's about, concerns.
Okay, the governor sort of took care of that today, and I see there was a press release out by our county as well, closing golf courses till the end of April 29th or whatever the date was. That's your understanding?
That is my understanding, yes.
Okay. Anybody else have anything for Kathleen?
Yes, one of the things psychologically, since we're penned up in our homes, what is the psychological implications or damage or cost to our community for the lockdown? I know that Elaine probably wants to be on the golf course.
I think it is hard, especially as the weather turns nice, to remain, in our homes. But it's, go, if you have a backyard, use your backyard. You can walk around the neighborhood, but keep your distance, right? I'm sure Ray could better speak to some of the psychological stress, but it really has been very helpful. I think people are cognizant of the fact that not only are there anxieties for someone who may be quarantined or isolated, but it's a different way of life. So like through our Facebook account primarily, but in other venues, we're trying to share information about, staying emotionally healthy and reaching out and making calls, and as well as physically healthy. It all matters.
Okay. Yes. Thank you very much. Thanks to the great work that you and your staff are doing. That's seriously.
Thanks.
Yep.
Happy Easter.
Happy Easter.
Mm-hmm. Okay. If we want to get through the agenda, we have the DSS resolutions that I'd sort of like to group together, HH 3 through 6. And, HH 3, 4, and 6 really are upgrades to existing staff. And that was the plan that was presented to us at our last Health and Human Services meeting. I did bring the resolutions back to the agenda with some amendments to the language, making it clear that no backfills of entry-level positions would occur until the COVID crisis was over or until we're fully operational at the county office building. And at that point, that would be the only consideration for bringing new staff on. So those three resolutions, HH3 was to create and fill a supervisor of family services, so assuming a higher level of supervision for some of the children and adult services. HH4 was to create and fill social welfare examiner, adding to a layer of supervision to the 4E process to making sure cases qualified for federal funding. And then HH6 was to create and fill a case supervisor grade B, which was referred to as the permanency specialist that was approved in the 2020 budget. And then HH5 was a little different, which was to create and fill an accountant position related to an anticipated retirement of an accountant supervisor grade A that's planning to leave leave county service at the end of May. And at that point, there was a conversation about changing that position from that title to an accountant. And that would, at this point, from my understanding, result in a brand new hire. So if I could get a motion and a second for HH3 through 6, then we can have any discussion.
Move it, Didio.
Nightingale, second.
Okay. Any discussion?
Elaine, again, this is Trish, and I would motion to table these and again go through the process with the committee that's been established to look at these positions kind of globally within the context of what's going on at the county. I know that a lot of work went into looking at reorganization of the department and that is supporting these resolutions and where we are today. I do think that all of these have value, but at this point, I do want to potentially have it go through committee for review before we take action on it.
Okay. Can I get a second for that motion? Amanda, do I need a second for that motion?
Yes.
Yeah, I need to get the second. I didn't hear that. Sorry.
The second was to table the resolutions until for 60 days until the June meeting, basically to reevaluate then and when we're back to hopefully more normal operations.
Okay, and who was the second on it though?
Nightingale.
Thank you.
Okay. All in favor?
Aye.
Any opposed? Okay, thanks. Before Ray, we ask Ray for any of his reports or see if Ray and Brenda have something to add to their report. I did want to discuss something with the committee in terms of getting their support for adding an additional resolution and forwarding it to Ways and Means. I sent it to the committee all by email today, which actually was a resolution that was presented last month. It was HH 18 at the time. And it's really a resolution to create and fill a 100% funded technical assistant coordinator position. This would be the third position we committed to hire when we received the startup funds for the Healing Community Study. And this obviously goes along with the grant we're getting addressing our opioid death rate. It looked like that things kind of were at a standstill in March, but certainly things are ramping back up again. There was a steering committee held yesterday remotely that I took part of. At this point, they're resuming the work this month. The standing committees are going to start meeting and moving some of the work forward. There was a request at that meeting by the funders for us to try to move forward, if possible, the county with that third position. And at this point, I think if you look at the resolution, it's clear that, this is all 100% funded. If the funding goes away, the position goes away. And as I said, we have already entered into a contract for this grant, and we did get $191,000 of startup funds, and part of that was to put these key positions in place. So if there's no objection, I would like to be able to have the committee's full support to bring this forward to Ways and Means this month so that we can move forward with getting this filled. And to Trish's point, if there is the hiring committee that's, in motion, that needs to review this, certainly that can happen too. We've got 2 more weeks till the Ways meeting is taking place.
Nightingale, move it.
Lattimore, second.
Okay. Anyone opposed or everyone in favor?
Aye.
No one opposed?
Aye.
Great. Okay. Ray, did you wanna, do we have any questions?
Madam Chair,
Yes?
since it's dealing with addiction, I think Chris sent us some information in regards to the Purdue lawsuit. Do we know how close that is in regards to maybe getting a partial settlement or anything to help us with the opioid crisis?
I mean, I don't have any, I know that we did recently get some kind of information from Chris, but I don't know, how close or how far away we are. Do you have any information on that, Rich?
Unfortunately, no. I'll have to talk to Chris about it.
Okay. And secondly, Madam Chair, the committee that's looking at hires and who's on that committee anyways?
Well, I think we, if I'm not mistaken, we did get an email in regards to that as well. Did we not, just Trish?
Yes.
Who's on that board, Trish? I didn't see that email.
The oversight chair, in addition to the department head and the chair of the legislature as well. Peter Jones.
Lynn Marinelli and Mary Beth Leeson, I thought, as well.
Okay. No, I did see that then. I thought it was I thought there was another committee formed. Okay.
Yeah, I think, Tim, there's this hiring committee that's being proposed, and they're trying to work out their process of, critically looking at all positions that are being requested to be filled to see if there is opportunities to get people's needs met in a different way. And then there's also a group being put together by Aileen to start to look at updating us on the financial picture of the county, whether that's in a meeting or a work session. I'm not really sure, but she definitely got the message loud and clear that people are very interested in knowing what our financial picture is so that we can make the best decisions we can.
Now you're talking, Chairwoman.
I would just add, the email does indicate that the hiring committee is going to be meeting twice a week until further notice. So they're going to be actively meeting from now on.
Great.
Yep.
Ray, we have questions for Ray, or do you have anything, Ray, you want to talk about?
Yeah, just for a couple of minutes, please. So I can't wait to see you all. These meetings like this are really different than face-to-face. I'd just like to just appreciate Kathleen and her staff for all the work that they're doing. IT has been really just like amazing in terms of, I think that, the Department of Mental Health, helped us convert rapidly to telephonic and telehealth services, which really kept us from having any interruption in services. I think that the child welfare staff, you guys approving the Northwoods work, was really key. We would have never been able to have those folks work remotely. The temporary assistance side of the department is 50% reduction. We're processing an awful lot of cases. A lot of people are requesting services that never had to before. I think our SNAP cases since the beginning of March, 403 new ones, which is a really significant jump for the county. We got people coming in the evenings, off hours to accommodate their schedule, and on the weekends. We don't have remote capability there. Security has been really good in the county office building. We're still open for emergency services, so we get about 5 or 6 people a day. So I'm really happy that you guys moved, untable resolution for that technical assistance coordinator, Monica, who's been doing a great job with the Healings Community Studies. Really, sort of most of her time is being spent public information duties for the county, which I think has really been helpful for citizens. You sort of keep pace of what's going on. I think we're doing all right on the homeless end. We're getting a lot of discharges, parole discharges, and jail discharges. Moving some people around. We're trying to keep the shelters from being full and dispersing people across the hotels and motels to make sure that we're really paying attention to social distancing and keeping people safe. And we haven't had any, there's always noise, but people are generally healthy. The case integrity staff has been put into play. We suspended all investigations and home visits there for fraud. And they're doing a nice job delivering food to people, keeping them from having to go out when they're in quarantine and stuff like that. So I think that both departments are sort of open for business and doing stuff, getting work done. And I think someone was asking about the psychological impact we're starting to see. I think if I'm on these calls every other day, the calls with Kathleen and the chairwoman and the hospital and law enforcement. So there's quite a few calls in the city, mental health calls. I'm not sure. It's too early to tell whether or not there's some sort of uptick, but you can sort of imagine that people's anxiety, their depression gets complicated and compounded by isolation. Most of the agencies they're concerned about their fiscal, a lot of the been some impact on billable services, there's been impact in staffing, keeping people in and being able to deliver the services. So we worry about their ability to make it through this. We're pushing out the state aid, I think, as quick as we can, and paying the contracts as quickly as we can. The thing with Grace's position in accounting, I know you guys tabled that tonight. It would be difficult to onboard somebody, but accounting is it's important for us to move money to people, to the landlords, to the vendors, to all the different people that DSS pays. I feel like Grace has a really good plan. She's got people working. Again, they're coming in on the weekends and in the evening to maintain social distancing and keep themselves safe. Personal protective gear, sort of trickling in. We have the same challenges that the hospital and the health department has in terms of the availability of that. Sort of scattered. I think Amy's doing a really good job at EMO trying to manage all this stuff. I think people really pitched in really well. We still do home visits I've suspended the home visits for the foster care preventive staff, except in extreme emergencies. Child Protective Services, we still have occasion to do home visits, and we have some practices around that in terms of doing the visits outside using technology. We haven't gotten a waiver to suspend that sort of stuff, so sort of taking some chances there. Juvenile justice side, residentials, the RTFs, residential treatment facilities and centers and detention facilities are not taking new admissions. Hospital inpatient units, not so much either, particularly on the children's side. So we have some challenges there in terms of trying to keep kids safe. Some AWOLs, anything, that whole business of the way that we were able to sort of protect kids and manage them has been degraded a little bit. I think what's hopeful is that we just spent the last, I don't know, 3-4 weeks sort of adapting to this, changing our practices and trying to make sure that we were keeping people safe and still trying to manage delivering the services. But I think now what we're realizing and what we started doing is being able to put back into play the the routine and the structures. I mean, and again, the 8x8 and all the IT has just been, it's really the way that they mobilized and how they sort of helped us is really has been amazing. So we're trying to bring back some of those structures. We're able to do the supervision and monitor the system and all of that. So we're pretty happy about that. So that's kind of where we're at, and be happy to answer any questions you guys have.
Any questions for Ray? Any questions for Ray?
This is Heidi, and it's a comment. I think that you and all of your staff are heroic in what you are doing, in the work you're completing under these remarkably unusual situations. And we know that with DSS and mental health, people present to you because of crisis. And so they are working in crisis during a crisis. And that's been readily on my mind. And I would like you to send a message to your staff about my appreciation and my my consciousness of what they're doing during this time.
I will. They will appreciate it. Thank you.
Tim?
Yeah, ditto, Heidi. Ray, do we know what the psychological damages, to our frontline people in just people being locked in with abusers or whoever?
So you mean like the impact on families?
Well,
like when you, so I guess I'm just trying to understand your question.
Well, let's say that there's abuse in the family and that you're locked in for a month.
Yeah.
The worst. I mean,
Hey, can I say, Ray, didn't we at the Healing Community Study, didn't they say arrests were down, but domestics were elevated?
So yeah, I think I think with law enforcement that they're seeing. So I think anecdotally they're talking about an increase in domestic violence calls, stuff like that, mental health calls. I think the impact is normally the way. So like from a family perspective and a child safety perspective and a victim safety perspective, access to being the ability to be able to ask for help has been greatly compromised. So kids aren't in school anymore. So the nurses or the teachers or the social workers or the custodians even, they don't have eyes on kids. Kids don't have those supports that they're sort of used to be able to talk about what goes on in their world. So that's missing for them. I think victims of abuse, whatever, sexual or domestic, can't count on having space to be able to, go disclose. A lot of the services that were mobile and available are sort of restricted now. And people are like really kind of stuck in place. So yeah, I think that, I mean, I don't have any hard data because it's too early, but I was on a commissioner's call today and get a lot of anecdotal information, and you can just I think it's safe to assume that absent the usual sort of relief valves in the system of monitoring and reporting sort of have become compromised. So I think it can be pretty dangerous to people. Sure.
Ray, your staff actually, when we met, talked about the huge decrease in what they normally see in child protective reports. And it certainly may not be because less is going on. It certainly could be the implications of not having eyes on kids. There's schools not there. I mean, so yeah, there are, who knows what the effects are.
Well, right. So you're right, Elaine. The child protective calls in the beginning sort of, dropped considerably. They're starting to tick up a little bit now and get closer to where they might have been, like if you look at historical trends and all of that. But you're so right. Yeah, like a lot of the during the school year, there's a great percentage of allegations that are generated by school personnel because they're seeing kids all day long. So those are missing now. I think that school districts are doing a really good job around delivering meals and seeing kids that way, and I think social media and everything like that. But yeah, there's no doubt that's been an impact for sure.
Is there any way we can account and charge back for those services?
Well, I think that we can. I mean, you can look at you can look at like if you can look at historical data and all of that, but there's so many variables in it anyways in terms of trying to learn anything that is sort of it's like you can point exactly to a thing because it's so many different factors that go into that. But I sometimes for us, I think, and for me particularly, a lot of times you're thinking intuitively. So you might not be able to stick an actual number on it in terms of like, what that impact has been in like real numbers, but you can definitely infer that knowing everything that we know about how stuff works with families and all of that there's some stuff going on that we don't know about and may never know about.
All right.
Well, let's say, I mean, like if we had to build a women's shelter, which, years ago when I was on council, we put one up. I mean, there's no way we can help those situations out with well, we really don't know about them yet. That's what you're saying.
No, I don't think you can know, but I think what's by getting this sense of, like earlier I was talking about, getting this sense of normalcy around the supervision of the services, so all the organizations and agencies, like I don't know what you guys see, but we get smashed with all different kinds of guidance that comes out for for all the different services. So all the organizations and agencies and support, victim support and all that sort of stuff, sort of like spend an awful lot of time trying to figure out, one, how to keep the doors open, two, how to do their services, how to be creative, how to be available and all of that. And I think that so it's hopeful, I think, is bringing back that sort of supervision and oversight of the system and the regular interactions that we would have to help them now. I think we have some breathing space, and so do they, to be able to sort of think about, okay, what can we do collectively to be smarter, to be better, to be more intuitive around how we reach people, how are we going to sort of navigate this. So I think that's kind of the stage that we're in, and I'll be able to give you some more information, I think, as time goes on in terms of how that plays out. I think everybody is being pretty heroic in trying to deliver the services. It's really just we got sort of hit and knocked off balance a little bit, and I think the system will hopefully reasonably adjust to kind of compensate for sort of the challenges that have been delivered to us in terms of business as usual and all that sort of stuff. So I don't know if that answers your question, but that's like the best I can do right now.
I want to give Brenda a chance if she wants to kind of give any information, and then we've gone through the resolutions, but Brenda, you've been hanging in there. Do you have anything to say, or is there questions for her?
Are our seniors getting fed, Brenda?
Yes, our staff have been amazing. Their dedication to keeping those meals going out every day has been unbelievable. The volunteers that normally work with us, some of them have had to step down, but we've been very fortunate to have others step up who are maybe now available because they're not working, or there's other situations where they can't do what they would normally do and they're available to help us. Jenna in the nutrition program and Kim have worked every single day, probably 7 days a week, to keep it going. We just coordinated a meal drop of 10 days of shelf stable meal in case, we do have a service interruption. We wanted to make sure those seniors who are used to getting our daily meal have some food. And all the Office for the Aging staff and some of their spouses all helped with that distribution. So it's just been an amazing effort. They're so dedicated.
Thank you.
So yes, the seniors are getting their food. We are concerned about their isolation because, of course, we're implementing some, very careful steps. The volunteers are screened before they go out each day. They're wearing masks. They all have been provided with hand sanitizer. Wegmans donated some bags. So we leave the food in a bag, knock on the door, and then step away from the door 6 feet. So we have no direct contact with the clients. So we do have some concerns about the isolation, the friendly visiting piece we're not able to do. So we are implementing a comfort call system using some of the volunteers who can't be out and about any longer, but want to keep in touch with people in their homes. So we're just getting in the process of doing those connections so that the seniors who really relied on those meal visits will still have a friendly voice to chat with.
Thank you.
Okay. Any other questions for, oh, Heidi, you want to say something?
I just wanted to tell Brenda that I look forward to the day that I can celebrate with all of those volunteers along with her. It will happen. We'll get there.
You missed your opportunity.
Yes, yes. And we in the midst of the challenges, we are grateful for all those people that have stepped up. It's really been something. Yeah, and I don't want to leave out our other staff that are in every day. It's you may not have noticed, but there has been no allowances and no changes as far as what people need to do and what the timeframes are to enroll in Medicare. So, there's the normal angst of what do I need to do and how do I do it to get my Medicare on time. It's heightened at this time because Social Security is much harder to get a hold of, and it's just a more complicated time. We had to cancel our Medicare 101 class, and so our health insurance counselors are still at it, still helping people, doing the one-on-one by the phone and in email, and the security folks have been wonderful as far as taking documents and things that are needed and relaying them to us in the mail. And I want to echo just what Ray was saying, that I'm so just so grateful for everything that Kathleen's been doing, the communication. We've been able to help a little bit to facilitate some communication with some of the long-term care facilities and such. IT has been just so gracious about helping us get up to speed. And then, of course, working across from Amy and Harry there in the emergency management, we've really been able to see how much they've been scrambling and how hard they've been working.
Well, thank you too, Brenda, for all the efforts of you and your staff.
Absolutely.
Okay. Unless there's more business, I think we can get a motion to adjourn.
Move it.
Happy Passover and happy Easter.
Yes, same to you, everybody.
Second on that adjournment to move.
Amanda, we all set?
Amanda? Madam Chair.
Oh, thank you. Sorry about that.
Madam Chair. Elaine? Elaine?
I believe she's off, Tim.
She's gone. Elaine? Is she there?
No, I think she's gone.
Okay.
So
All
Amanda,
right, thank you.
This is Nightingale. We just wanted to let you know that Tim moved to adjourn. I seconded that for your notes.
Got it. Thank you.
Okay, thank you. Have a good evening, everybody.
Do we want to, for the record, just vote on that? All in favor of adjournment?
Sure, I'll be de facto chairwoman. vote, all in favor to adjourn?
Aye.
Aye.
I think
Thanks,
we are.
guys.
Good night.
Good
Good night,
night.
everyone.
Good night.